Welcome to this virtual walkthrough presentation on Assam Teleradiology project brought to you jointly by National Rural Health Mission, Government of India, Department of Health and Family Welfare, Government of Assam, and HealthFore Technologies Limited. This project was initiated to address the primary objective of bridging the demand and supply gap in various government healthcare units to manage radiology services. This project is the first of its kind in the nation in the public health sector driven by a partnership model. The project aims at reducing the turnaround time in accessing specialist radiologist skills from remote locations. This project leverages advancements in medical technology and information technology to deliver cost-effective healthcare. The scope of this project is to cover a total of 11 district regional diagnostic centers across the state of Assam. It begins with the establishment of a data center and also the supply and installation of an innovative technology software to manage teleradiology services. It also involves staffing all the 11 diagnostic centers with required administrative and paraclinical staff to manage day-to-day operations. And finally involves providing specialist radiologist skills to manage remote consulting. Here you see the 11 district hospitals that will benefit from this project. While some of the centers have already been commissioned, the remaining will be commissioned in a phased manner. Now let us take a closer look at how each of the 11 centers are connected to the remote reporting cell. The main data center is situated in the capital city of Guwahati and is housed at the Mahendra Mohan Chowdhury Hospital, popularly known as MMCH in Guwahati. The data center has been set up with state-of-the-art infrastructure to manage all aspects of the teleradiology program from an IT perspective. Each regional diagnostic center is connected to the data center to transmit radiology images for reporting purposes. This is the Mahendra Mohan Chowdhury Hospital, which is MMCH in the Kamrup district of Guwahati. The Mangaldovi Civil Hospital, situated 60 kilometers from Guwahati. The BP Civil Hospital in Nagaon district, which is 120 kilometers from Guwahati. The North Lakhimpur Civil Hospital, 400 kilometers from the main city. Jorhat Medical College Hospital in Jorhat district, situated 310 kilometers from Guwahati. The Haflong Civil Hospital in Deep Hasao district, 300 kilometers away from Guwahati. SM Deb Civil Hospital in Kachar district, 350 kilometers away from Guwahati. The Hailakandi Civil Hospital, which is in the Hailakandi district, situated 325 kilometers from Guwahati. FAA Medical College and Hospital in Barpeta district, 100 kilometers away. RNB Civil Hospital, 225 kilometers away from Guwahati. And finally the Dhubri Civil Hospital, which is again 300 kilometers from Guwahati. Apart from having a data center in Guwahati where radiologist services are made available, there is an alternative reporting location situated all the way in Delhi, which is 1800 kilometers from Guwahati. Now let us take a virtual walkthrough of a patient's journey within the teleradiology program. The patient's journey begins with a patient approaching one of the 11 diagnostic centers for radiology services. Begins with patient registration followed by billing. It also involves a triage where we differentiate normal cases and emergency cases, and followed by conducting of the radiology exam, followed by the remote reporting by a specialist radiologist, concluding with the patient collecting his or her radiology report. Step 1 involves registration process where a patient arrives at the reception of the radiology department. The patient's contact is with a receptionist. Patient's identification details are captured as part of the registration process, which also includes screening of BPL card patients for availing BPL card benefits. All the necessary documentation are collected, scanned, and uploaded onto the system, and it's concluded with billing and cash collection. Below are snapshots of the software solution provided by HealthFore, which enables process automation at this stage. Step 2 is at the exam room, where patient arrives for having his radiology exam completed. Patient's contact is with a radiographer or a technician who is also empowered to triage emergency cases, and once the completion of the exam or procedure is completed, the images are digitally acquired and transmitted to the data center. The software solution provided also enables the radiographer to manage film inventory. The next step is for resulting, where images are transmitted remotely to the reporting center. There is no patient contact at this step. A radiologist sitting miles away from where the patient is situated is in a position to view images and interpret them, and based on the interpretation, the diagnosis or impression is documented and reporting is completed using the innovative software solution provided by HealthFore. The final step of this process is for patients to collect their results or reports. There are two options available for patients. The first option is for patients to physically collect their reports at the radiology center. Patients come in contact with the receptionist who is responsible for printing of reports and films. The turnaround time for urgent cases, reports are made available within 1 hour from having the examination completed, whereas for routine cases it is within 8 hours reports are made available to patients. An alternative means of accessing radiology reports for patients is to visit a patient portal. This eliminates the follow-up visit required to go back to the diagnostic center to collect reports physically. Portal access is provided as part of the billing invoice. All patients have been given access to the patient portal, where they would be able to view their reports as well as download those reports for a physician's review. To conclude this project, in addition to delivering benefits in terms of a financial dashboard for better decision making, also is resulting in reducing the cost of radiology services, increasing the quality of radio diagnosis, as well as improving the turnaround time for accessing radiologist skills from remote locations. To conclude, this project is yet another testament to technology enabling quality health care more accessible and affordable.